and they're here to talk to us about giving really an overview of the work on PI, which is the psychologically informed environments part of we funded part of that through BCFT, and also they've had funding from lots of other environments now, because it really took off and grew and became something that's very much become embedded into the city of Birmingham, I would say, and what the city expects for people's support. They're also going to talk about the importance of keeping people in the universal space and what we mean by that. So if they are both ready, I'll hand over to them, and I can see them now. Thank you very much for joining us and welcome. I'm going to switch off now and hand over to you.
Thank you, Sian. Thank you very much. Great to be here. And it's been such an inspiring day so far. I think Amanda and I had a quick catch up at lunchtime, and we kind of want to rush and change some of the slides and just weave in everything, all of the conversations and the presentations. So yeah, we are Amanda's going to lead off and talk a bit about what a psychologically informed environment is and the approach that we've taken through the program, and then I'm going to pick up near the end and kind of weave it into that sort of systems piece, and you know, within the sort of topic of today, which is, you know, sort of picking up the baton really and how we take it forward. So I'm going to pass over to Amanda.
Thank you, Jean. Good afternoon, everyone. We're not often starting early, so I'm just going to double check with Jean. Am I slide sharing?
You are. Please, please. Is either you or Jan, because my technical skills are probably like not good enough.
I was just, it's come up slightly differently than it normally does, so I wasn't sure whether I'd been successful, but that's good. So afternoon, everybody. Yes, I'm Amanda. And I've been working with St Basils now for it's over 10 years. And so I'm going to tell you a little bit about psychologically informed environments. I know so many of you out there already, you know, you've been on the PI training, you're already very aware of psychologically informed environments. But we have a saying when we start our training, we leave no one behind. So we always make sure everybody knows the sort of basics, so they can join in. So I'm just going to sort of give a very quick overview. And as Jean said, it's just been really so inspirational to hear about all the work that's been going on, and to reconnect with sort of Bev and Colette and Earl, and I remember you all on training, so it's all very, very exciting. So we started, just to give a bit of context, Jean and myself had been working within St Basils to think about what PI would look like for young people in St Basils, to develop a training programme along with Professor Nick Maguire. We've been doing that a number of years when we were asked by Natalie, hello Natalie, I saw you on the call, and Ruby, if we could provide something similar for Changing Futures. And initially we were a little bit like, because we hadn't thought of doing it anywhere than within St Basils. So we thought about that and how our training programme internally might be adapted and used for people with multiple disadvantage. So, as I say, for those of you less familiar with PI, these are the sort of key areas that we think of. So developing a psychological framework, and I'm going to tell you just a little bit more about the St Basils model of that PI. Thinking about physical environment, social spaces, but really important in that element, we really think as well about making sure that our environments and our cultures are fit for purpose by making sure they're co-produced. They're produced with the people using the services, and this really fits into all that we've heard about the success of sort of peer mentors and having people who are experts by experience. We've then got the sort of staff training and support, and coming out of the rough sleeper strategy in 2009, it was really evident that those with the most complex needs, with that multiple disadvantage, were often supported by staff who were doing their best but didn't have the training and support to really understand, you know, what would be helpful to some people who were sort of often in crisis. And our PI mantra is very much, it's about relationships. And you've heard an awful lot about relationships between the workforce and people receiving the service, but also between organisations. And Alana, you were saying, you know, that no wrong door network, that partnership working, seeing other agencies and workers within other agencies, building up those relationships to work more effectively together rather than trying to work in your silos. And all this has to be backed up. And I must admit, I was sort of frantically writing down when Jan was presenting this morning, because it's based on evidence and evaluation, not on what just feels right or seems right at the time. And this is underpinned by that reflective practice, that ability to step back, really look honestly. So we talk, when we're thinking about that PI culture, we talk about our 12 C's. And you've heard a lot of things about, you know, sort of the need for being caring, compassionate, calm and considered, particularly, you know, working in places like John described, like A&E, where things can feel very pressured. There's, you know, a lot of stress. And again, Alana's presentation, I think you had at least 4 of these C's, I counted, Alana, on some of your slides. So being collaborative, connected, curious, creative, consistent and candid. And, you know, we heard again sort of how our peer mentors are sometimes having those quite hard but honest conversations that are needed, that sort of consistent support. And being courageous and sort of having that confidence of keeping going, keeping trying. So our PI pyramid, our PI model, and really what we're trying to get people to understand is that first step of listening, really hearing the people who are experiencing those difficulties, who are experiencing that homelessness, really listening to their stories. What have they got to say? What do they want? And I think tempted, particularly, I think sort of, you know, myself, I'm NHS, we can be guilty of trying to get to the top, trying to get towards sort of change over here, trying to get, you know, sort of an outcome, but trying to not sort of spend time listening and validating the people who we're hoping to help. So those are our sort of 2 basic rungs. And then once we've established those relationships, we can explore, we can formulate, understand what is going on for that person, what might help, what's the next step look like. And together, that's where we get to that learning, where we have growth and change. But we haven't put change at the top of our pyramid, because actually sometimes just listening and validating somebody can help start their journey of recovery, their journey of change. So I'm not going to spend too long on this slide, because I think it's already been sort of referred to, but it's our PI learning, our PI understanding really starts with understanding that, you know, as was said before, people's journeys start with sort of multiple disadvantage, with inequality, poverty. And also, I mean, some of our research that we're doing in-house is really showing unmet cognitive and psychological needs. So we are overrepresented with people on the autistic spectrum, with attention deficit hyperactivity disorder. And as they move throughout childhood, what we have is then people who lack self-worth and skills, they have problems managing their emotions, and then they engage in coping strategies that become problematic, such as drug use, substance misuse, offending behaviours. But that results in further exclusion, which, you know, we need to, that's for psychological safety, we need to feel connected. We need to feel that we belong somewhere. And so it's really important that, you know, we think about those sorts of psychological concepts when we're building and designing our purposes. So sometimes there's confusion over different models, and I'm often asked to talk about, you know, what that actually means. So I'm going to just go through the models briefly, just so people can understand. So our PI starts with ACEs, that research that really cements the links between adverse childhood experiences and poorer physical and also mental health outcomes. And then we're hearing a lot about trauma-informed environments. So that's where staff understand the impacts of trauma in later life, but also have strategies to work with those people who've experienced complex trauma. But PI goes a little bit further, and Jean and I are always quite passionate about saying why we think that PI is so important, because we're applying those psychological principles, that scientific evidence, not just to people with trauma, but all people. So asking the question, why is it sometimes that staff aren't working in a psychologically informed way? You know, because actually, if we think about it, it's not because, you know, I wake up one day and I think, I'll tell you what, I'm going to do a really bad job. I'm going to be really unhelpful today. So actually, part of our PIs is applying PI to systems. And Jean's going to talk to us more about that in the second half of our presentation. So why PI? So PI is an approach for working collaboratively with clients with support needs to achieve their goals and ambitions. In particular, it's designed to provide a positive environment for those who've experienced complex trauma. So you can't have a PI that doesn't have a significant component of trauma-informed care. It supports a service culture that values relationships, creates space for reflection, promotes psychological safety for staff and clients, and shared solution finding. So our journey with Birmingham Changing Futures. So you already know, and you've already heard lots about the No Wrong Door network, supporting those with multiple and complex needs, multiple disadvantages. And we were asked, and I mean, one of the first questions we were asked, weren't we, Jean, by Natalie and Ruby, was we're going to have peer mentors on the training. What's that going to look like? And I was like, I don't know, really. I'm going to have a really good think about this. And most importantly, I'm going to have to ask the peer mentors themselves to feedback on the training, feedback what was their experience like. And I must admit, there was a little bit of anxiety when I first embarked on this. Just what would they think? So our PI programme starts with 3 days of foundation training. So these tend to be split over sort of 3 or 4 weeks, to give people a chance to sort of consolidate their learning from one day, practice some of the tools, some of the learning, and then come back on the next day and then learn the next stage. And really important for us is the reflective practice sessions that follow. So these were all delivered by clinical psychologists. And we spent a lot of time with the delivery partners thinking about how we would organise their reflective practice groups, how they were configured. We had separate groups for managers because it was felt we really wanted frontline staff to feel that they had an open forum to talk, to reflect, to think about their work. And these were organised. And I think one of the learning was just how much practical operational organisation we had to do to make all that happen across the different organisations. And for us, it was really important. It was an iterative process to make sure that the course and the reflective practice were constantly, we got feedback from everybody, and we did improve. And one of the improvements was Colette. I don't know if she even remembers saying it to me, but she went, "Oh, I really hate that term," she said, and she suggested another one. And Colette, we use it to this day. So we really did take on board that learning and you know, the feedback. And we also looked at questionnaires and to see, you know, was it having an impact? Did people's knowledge and understanding about trauma improve? Did it also impact on staff well-being? Did they feel more equipped in order to do their work? So we started in June 2016, and this was delivered over 2.5 years. And it was really, as Alana said, we'd go along to the No Wrong Door networks, we'd talk, we'd explain what PI was, we'd invite people to come along and really try and get that buy-in and that understanding. Because if anybody who's put on training that isn't funded within the organisations it knows, is that sometimes free training can often be a little bit devalued. So we did a lot of work trying to get that sort of buy-in. So across those 12 months, we gave the sort of whole PI programme. So that's the training and the reflective practice group to over 200 staff and 15 organisations. And just as a quick aside, and in terms of sort of legacy, that's now gone for, we've now trained well over sort of, I think it's 1,200, it could be even slightly more, frontline staff and managers. and that's now across more than 50 organisations across the West Midlands. So that, as Sian said, has really grown and developed. So just a quick view, we've got sort of multiple outcomes, but just a quick of the key ones, that actually from the training, we found that 97% of people had improved their understanding of implementing PI in their roles. So what did it look like in an operational sense? Not just the theoretical of what is a PI, but how does that look for their role? Again, we talked about the reflective practice, and 96% of people identified that it helped them build positive relationships and really empower clients, really work with people, not doing to or for them. And one of the things that we found in looking at some of our outcomes was that the reflective practice kept, so just after training, obviously people are enthusiastic, they want to have a go, want to implement. But with the reflective practice, those gains, those improvements were maintained at 6 months and also a year. So what did we learn? So some of the key learning is that in order to be successful in terms of organisations needed to be clear about their own PI journey, and what was it in terms of psychologically informed environments that they wanted to achieve, what were their outcomes, and those organisations who had a good idea tended to be able to sort of implement and sustain those for longer. Service user and staff involvement is essential for good outcomes, so it's that real process of feedback and learning and co-production. It has to be core business. PI isn't something you do between 3 and 4 on a Tuesday afternoon and you don't do any of the rest of the time. It has to be thought about in terms of processes, procedures. It's no good asking staff to work in a PI way and then having a PI program, or policy that doesn't fit with what you're asking staff to do. It recognises the skills required. It provides that coherent framework, as you saw, our pyramid. And you need explicit buy-in from senior leaders and managers. Just something as simple as attending reflective practice can only be done if managers have made sure staff are freed up during that time and they're not busy catching up with emergencies. PI is more than just a training course. You have to think about the elements that you require in order to sort of implement it and then sustain it. And successful PIs need to find a balance between maintaining consistency and embedding that learning, and being evolving and making sure that we're constantly revisiting the evidence base. And also embedding techniques and the approach in all areas of work. So thinking about, everyone from, receptionists, admin staff, central services, so frontline staff, where teams had got their central services involved, who were also psychologically informed, support that PI approach. And I'm now going to hand over to Jean.
Thank you, Amanda. Thank you. So a lot of the program and when you think it's back to 2014 and I've been privileged to be involved in the core program group since that time, and so much learning and just having it all brought together today is kind of just both inspiring and a bit overwhelming, because there was Colette, you put in the chats, and it was just a little comment about you missed the collaborative working methods that we all once shared. And I suppose for me, the kind of critical element of the whole program for me is, how do we influence the system change? How do we make sure that all of this learning that we've had and all the good approaches and the good work and the co-design and co-development, how does it actually influence and change our mainstream systems? And they are really complicated things. And if we see how much has had to go in to sort of help navigate people through and benefit from them and all this learning, how then can we make those mainstream systems fit for purpose the way that we've learned? And systems are complex things. And Simon this morning said systems are all about people. Well, they are all about people, but there's all different parts of particularly the big systems that we operate in, with health, with social care, with education, with employment, with benefits, with all of those different elements and the different parts of it. And it's very easy. We all only know bits of it. And one of the really interesting things that I know a number of us were on, that were part of the program board, is a system change program course that we've been learning from, and certainly I found that extremely helpful. So it is about people, and we can all, but we want our system to be greater than just the goodwill of those that have an understanding. And we want that system leadership to take this learning and look at how can we build inclusion into our mainstream systems, rather than waiting till everybody tumbles out of them and then we wrap around them and we help them re-navigate. And, you know, the diagram there shows how complex it is. And the bit in the middle, I've put in that little cloud of inclusion. It's not because it is there. It is because that's ideally what we would like. We would like our mainstream systems to be joined up. You know, we would like, you know, a whole system approach ideally. But Alana, absolutely correct in the sense of, you know, you have to push where you see that there is movement and where it's most likely to happen. Because if you just wait until the whole system changes, you are going to be struggling. But I do think 8 years of learning, 8 years, we have to be able to influence those mainstream systems and take on board and embed so much of this learning. Otherwise, it'll be another pilot and then another pilot, and then we'll you know, eventually, oh, we've learned all of this, wasn't it good? And again, coming back to Colette, I'm so glad you opened the whole session, Colette, because what you illustrated was that whole part. You know, the age, you talked about your experience as a child, you talked about your experience when you were 11 years old, you talked about where you were and the place that you felt you were in at the age of 20, and then how long it had to go on and how much had to come to help you move out of that. We have to move. It's Simon and government. It's fine when they talk about prevention in the sense of rare, brief and non-recurring in terms of rough sleeping. But for me, prevention has to take all of these lessons and push it way upstream, not the night before or the week before or whatever that you are going to be in crisis, but right upstream, so that, you know, Colette as a child and others, there is that help up there. We are not waiting until everybody tumbles out, because when everybody tumbles out, Earl, I'm like you, I can write anything down, I'll take no notice of it, I just get carried away. So I'm sorry. Would you move to the next slide, please, Amanda? But when we tumble out, you know, we fall out and we get exclusion, and we need lots of other things then, don't we? We need navigators, you know, we kind of tumble out of these silo systems that don't talk to each other, that are quite difficult to reach. And people talk about people disengage. Well, why wouldn't you? It's so hard to engage with many of our systems. And I think all of us, regardless of multiple disadvantage, you know, it's not experiencing multiple disadvantage from our perspective. You try to have engaged with the system during the last 2 years of COVID, and the feedback that you get immediately from people is like, you know, you couldn't engage, you couldn't talk to a person, you had to wait, you couldn't. If you haven't got then resource and capacity, and you just think, do you know what, I just cannot be bothered, as Michael was saying, I just don't want any of that, don't bother me. Having the hope is the worst thing, because when hope gets dashed, you're in a worse position almost than if you didn't have it in the first place. So I really feel passionately that we have to go beyond relying on individual goodwill and individual compassion and individual training. I really think systems leaders, you know, across our mainstream systems, we have to take this learning on board, and we collectively have to make sure that people do, because you can pass a baton on, but you have to be willing to pick it up. And I really, really think that we've got to be doing that with our systems, and we have to be embedding this learning into our mainstream systems. And we don't just want to have things that are called integrated care systems. It's just another name if we don't make sure that it truly is integrated and we take all of this learning on board. Next one, please, Amanda. Now, it's interesting, and again, our little chat at lunchtime, Amanda and I like threw this slide in really quickly, but it came out of the session that you know, Stuart Bev and Michael gave earlier, and it was just listening to what you were actually saying was important. Now apologies if we've misinterpreted this, but our hearing was that what you were saying is we need systems that allow workers to be persistent, to keep going and be there when the person is ready, not to have a caseload that's so huge that you try 3 or 4 times and then you move on somewhere else and they didn't engage. We need, I think what we heard you saying was that we need also systems that enable and permit workers to build relationships and not have it absolutely linked to a target or a goal or an outcome that has to be achieved. Because that means that people go, well, okay, you only want me for this. And I know we at St Basils we've had social investment bond scheme, and some of our young people felt commoditized by that. Okay, because they knew that their worker was only going to get the money for the program if they got the outcome with the young person. And then the young person thinking, well, do you know what? Yes, I want to help my worker, but actually, am I just there for the money? So that enabling is really important, not with the other goals. We need to ensure that we have systems that just allow that. I love that, that professional. It wasn't about the police. And as Michael said, it wasn't about, you didn't even ask questions about the crime or where you were getting your supply from or anything like that. That's incredible, because the goal was about to have that trust. And the thing that we learned on this program around system change was that, partnerships, 64% of all partnerships fail because of failed relationships. It's not about all the other things. It's because the relationships and the trust is not there. So we have to work on that. And we want systems that actually permit workers to care about people, not take control from. And that is really hard, because there's all kinds of issues around professional boundaries, around safeguarding, around all sorts of stuff. But we shouldn't leave that down to the worker and then blame the worker when it all goes wrong, because that's what happens as well. Systems and organizations have policies to defend the system and the organization often. And that means throwing out your worker to take the blame sometimes. So I think, we collectively, at all levels, at political level, at system leadership level, across systems, we have to take these lessons on board, and then we have to see how can that help us make the system much more fit for purpose. And Sian talked about the universal space, and for me that is the universal space, the space we all occupy. How do we keep people in it, rather than enabling them to tumble out, sharpen our pencils, bad performance, didn't engage, blah, 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 sharpen your pencil, out they go, tumble, tumble, tumble. Oh, multiple exclusion. Oh, we need a program. No, let's have that, wind it right back and make those systems fit for purpose and inclusive. Thanks, Amanda. And it's just, you'll be pleased to know this in the final one. It's just really, there are means of doing this, and lots of people have referred to them about how you do it, and it is that collaborative approach. And I think it is, we used in the combined authority around the homelessness task force, we used a SAW model rather than a SWOT, because the trouble is, if you do strengths, weaknesses, and then you do, you do weaknesses and you do threats, 50% of your time is spent on computer says no, why you can't do things. If you use a SAW model, you use strengths, you use opportunities, what's our ambition, what's our results, and you co-design and co-develop it together, then you're far more likely to focus on what's possible and what can be achieved. And that's what this program, this last 8 years, has absolutely shown what's possible. And at any level, financial, social, human level, look at the phenomenal savings and reinvestment back into our communities. So I just say, let's not let it end here. Please, Colette, don't let it be that we don't have this experience again of working in this collaborative, compassionate way. And I just, make big thank you to everybody. I've learned so much, and let's not stop here. Thank you.